Welcome to Raaonline. Today I will be talking about diseases of the middle ear. Any infection involving the middle ear cleft is called as otitis media. It is of two types. Acute otitis media is something which is abrupt and resolves quickly, whereas an inflammatory condition which results in the perforation of the tympanic membrane and lasting for over 3 months can be categorized as chronic otitis media. Take these two clinical scenarios. A person with acute otitis media usually presents to the outpatient department with acute ear pain, with or without discharge, may or may not have fever, but there will definitely be some history of upper respiratory infection, usually seen more in children or in people who have been having a chronic sinus infection or acute sinus infection and who have traveled recently. In case of chronic otitis media, the person may be giving a history of recurrent history of ear discharge, which has been on and off, sometimes even since childhood. The discharges of different types, it can be watery, it can be serous, it can be mucous, it can be mucoid, there can be some purulent discharge or sometimes associated with blood. So these patients who will definitely have perforation of the eardrum or the tympanic membrane, we should usually categorize as chronic otitis media. So if you look at the pathological definition of otitis media, it is an inflammatory process of the middle ear which is associated with irreversible changes. These may be present even when the tympanic membrane is intact. So coming to chronic otitis media or COM as it is called now, previously it was called as CSOM or chronic suppurative otitis media, can be divided into three types. One is the silent chronic otitis media. Then we have the non-cholesteatomatous otitic media or NCCOM or a cholesteatomatous otitic media or the CCOM. If you look at NCCOM or the non-cholesteatomatous otitis media, it can be because of a recurrent otitis media, recurrent attacks of acute otitis media, acute necrotizing otitis media. It can be as a result of trauma, or it can be because of some socio-economic factors. We will look briefly into all of this. If you look at the clinical features, it is common to all types of NCCOM. So primarily you have episodic otorrhea associated with upper respiratory infection. Otorrhea means ear discharge. It could be because of water contamination. There is definitely some inflammation to be seen. It can be categorized as safe or benign, and it is called as tubotympanic disease, or it can be categorized as unsafe or aggressive type of disease, which is usually the atticoantral type. So safe type of ear disease is usually of tubotympanic variety, and the unsafe type of the NCCOM is usually of the atticoantral type. These are the different types of perforations that you can see. This is the commonest one, a small anterior inferior perforation, or it could be a posterior inferior perforation. This, because of recurrent ear infection, can lead to a large central perforation, or it can present itself as a large central perforation depending on the severity of infection. And when just a small rim of the tympanic membrane is remaining, you can call it as a subtotal perforation. And if even this rim is absent and only the annulus is present, it is called as a total perforation of the tympanic membrane. If you look at recurrent otitis media, so it is because of recurrent attacks of otitis media. So you have persons with usually with chronic sinus infections. The infections get into the middle ear and they have these recurrent attacks of middle ear infection. It is usually also can be due to inadequate treatment. So if a person comes with an acute otitis media and is not treated properly, this can become a chronic problem and becomes a recurrent otitis media. And also could be because of local conditions like allergy. The allergy can be like, it could be sinus allergy or allergic rhinosinusitis, and this leads to a eustachian tube dysfunction, or it can be a eustachian dysfunction primary and leading to the tubotympanic secretions entering into the middle ear, or it could be due to some immunodeficiency issues. Acute necrotic otitis media is usually silent. The discharge is profuse and frequent toileting, which means frequent cleaning is needed. The clinical features shows early central perforation. So when you have like recurrent attacks of acute otitis media, usually you have small perforations which close, then it reappears, then it closes. But in case of acute necrotic otitis media, the perforation appears very early on in the disease. And usually in chronic cases, you have large central perforation with granulation around the edges. In case of NCCOM with trauma, usually the traumatic perforations heal. But in some cases, large perforations, or when there is an added infection when the perforation or the trauma happens, these don't close and the perforations become the perforations don't close and they epithelialize and a central perforation forms. In case of recurrent upper respiratory tract due to ET dysfunction, this is usually seen in children with adenotonsillitis, because usually if you look at the adenoids are here and the eustachian tube orifice is just in front of it. So the adenoids usually then cover the eustachian tube orifice and prevents drainage of the discharge, or the discharge from the postnasal area gets diverted into the eustachian tube and into the middle ear. And these children have recurrent middle ear infection because of adenoid hypertrophy. And it can also be seen in patients with adults with eustachian tube dysfunction. Eustachian tube usually collapses when swallowing or in a normal resting state. And whenever you swallow or with the middle ear pressure needs to be equalized, the eustachian tube opens. In cases with adults with eustachian tube dysfunction, this function is not happening properly. So any discharge from the nose can get diverted into the eustachian tube and into the middle ear. Now, socioeconomic conditions predisposing to NCCOM will be low income, poor hygiene, malnutrition, all are related. And it is seen that people with low income usually have live in poor hygienic conditions and also are subject to malnutrition, and these three together cause the immune status to come down, and they are more predisposed not only to chronic otitis media but also to all other diseases, infectious diseases. So if you look at tubotympanic disease, which is the safe type of COM, it can be divided into two types. One is the LIL type 1, which is a permanent perforation, and LIL type 2, which is chronic tubotympanic mucosite.